Good afternoon and welcome to the Employer Link webinar series presented by McAfee and Taft. My name is Brad Neese, Managing Editor of Employer Link. Today we'll be discussing company-sponsored wellness programs that an increasing number of employers are implementing as a way to encourage employees to live healthier lifestyles with the intended result of increasing productivity and reducing overall healthcare expenses. McAfee and Taft attorneys Bill Frudenrich and Charlie Plum will discuss some of the issues employers must consider in making sure their wellness programs are well-designed and legally compliant. But before we get started, there are a few notes about today's presentation. First, this program has been approved for 1 hour of general recertification credit through the HR Certification Institute. For those who signed up for HRCA credit at registration, we will be sending a follow-up email the next day or so with program details about today's webinar for recertification submission. Second, on your screen just below the slide presentation area, you should see a tab called Supporting Material, and that will allow you to download a PDF version of today's presentation materials. You can also find those on our webinar resource page at employerlink.com/wellness. As I mentioned earlier, our presenters today are Bill Frudenrich and Charlie Plum. Bill is an employee benefits attorney who assists employers of all sizes in designing, analyzing, and implementing cost containment strategies for company-sponsored health and wellness plans. Since the passage of the Affordable Care Act, he spends much of his time counseling clients on a broad range of legal, tax, and cost-benefit matters related to healthcare reform, including player pay, healthcare exchanges, changes to flexible spending accounts, and a myriad of other issues required to maintain legal compliance. Bill is particularly regarded for his keen understanding of benefits issues and his practical advice. Charlie is a labor and employment attorney who is a frequent speaker and author on workplace issues. In addition to being a regular presenter for our webinars and seminars, he serves as legal editor and contributing author for EmployerLink.com, co-editor for Oklahoma Employment Law Letter, as well as co-editor for the Oklahoma section of the annual guidebook for employers and HR professionals called 50 Employment Laws in 50 States. Much of his practice is dedicated to counseling employers on compliance with a broad range of state and federal employment laws and regulations, and educating management on best practices for avoiding disputes arising from the employer-employee relationship. So with those introductions, I'll now turn it over to you, Charlie.
Thanks, Brad. Afternoon, Bill. Penn State University made the news again a little bit earlier this month, this time on a little bit different subject than we've been reading about Penn State. They announced in early August what they describe or call their Take Care of Your Health initiative for the employees of the university. And as you might expect, Penn State has about 40,000 individuals and family members who are covered by their employment health insurance. And under this Take Care of Your Health initiative, employees will be required to submit to a biometric screening, which would include testing blood sugar, weight checks, and waist sizes, as well as completing an online wellness profile. And if one of the Penn State employees declines or refuses to participate in this Take Care of Your Health initiative, including the biometric screenings and the questionnaire we've described, they will be penalized $100 a month. Now, Penn State really is following the lead, perhaps a little bit differently from some employers, as we're going to discuss, but it's following a trend right now where employers are looking seriously at adopting and implementing wellness programs. And when we talk about wellness programs, we're talking about programs or activities that an employer has sponsored within their health benefit plan. And it's a program or activity with an objective of promoting and maintaining employees' well-being. And keep in mind, that's not limited to just physical well-being. Many of these wellness programs we're seeing now also have a psychological or emotional element as well. And we're going to be talking about two general types or categories of wellness programs currently in place. One category is something we'll call a participation-based wellness program, and that's a program in which you can qualify for rewards or incentives for simply participating without satisfying any particular standard or hitting any particular mark. The second broad category is what I'll call health contingent wellness programs. And for health contingent wellness programs, which we're going to get into a little bit greater depth with Bill, that is a program, a wellness program, in which the employee must not only participate in the offerings, but they must satisfy certain health standards to qualify for a reward or incentive. Some common examples of wellness programs or wellness program elements are programs which have some sort of health risk assessment, maybe akin to the questionnaire the Penn State employees are being asked to complete. A wellness program may include a tobacco use cessation or a stop smoking program. Nutrition or weight loss programs are not at all unusual, or some sort of disease management program. But again, these programs are aimed at encouraging employees to lead healthier lifestyles and thereby reduce risk of disease, presumably. But also, as you can tell, our Penn State example being not at all uncommon, it invariably involves disclosing health conditions of the employee or the employee's family members. So what we're faced now with employers, and there are a lot of good reasons to consider and implement a wellness program, we're faced as employers with issues that are raised under both our employment laws, things like the Americans with Disabilities Act and GINA, while at the same time our health care laws have their own requirements. And the challenge we hope to address today in our webinar is how you as employers can best navigate and satisfy both sets of these rules and requirements, those that are imposed by the employment laws I've discussed, as well as health care laws that Bill's going to touch on. We provided our material just because it is pretty amazing. This chart you see right now shows the kinds of chronic conditions and deaths that statistically we're told are associated each year with smoking, and the various causes or symptoms or conditions that fall out from that. The reason we've included this in our material is that seems to be one of the most frequent and in some ways easiest elements of a wellness program, some sort of tobacco use or cessation. And the common wellness program goals we see are really three types of general offerings. I mentioned the reduced tobacco use, some sort of cessation program or education program seeking to reduce tobacco use both by employees and their family members. Also, a lot of the wellness program initiatives address obesity and poor lifestyle choices. Again, the idea to reduce health risks. And then the third category of offerings we see in wellness programs offered by employers are detections or screenings with the real goal to catch problems to the extent they exist with employees' health or family members' health early so we can improve health outcomes. And maybe this is a good time really to jump right into the health reform laws and how they impact wellness programs and what employers can do and can't do in that regard. Bill, can you get us started in that direction, please?
Yes, thanks, Charlie. Before we get started with the details of the Affordable Care Act, I want to go through a history of where we've been and where we are now in the legislation of the HIPAA wellness rules. We first saw the HIPAA wellness rules in 2006. Now, those were in the form of regulations, and they were not part of the Internal Revenue Code. And in 2006, we first saw this concept of participation versus this health contingent wellness program. The 2006 regs were a little loose. They didn't define very many of the terms, so we've been dealing with a lot of confusion with the wellness regs. Well, then we have the Patient Protection and Affordable Care Act in 2010. They took the wellness regs and they put them into the Internal Revenue Code. And what's the impact? Well, now The true impact is we can now assess penalties, monetary penalties, if you don't comply. Plus, with the 2010 code, we've now increased the wellness incentive from 20% to 30%.
And Bill, for clarification, the penalties you're talking about now that it's within the Internal Revenue Code, those are penalties for employers having non-compliant wellness programs.
That's right, and those will be collected by the Internal Revenue Service. Now, here we are in June of 2013. We have comprehensive final regulations dealing with wellness. Now, there's three main points that I took out of those regulations. First, prior to the final regulations, we basically had what I would call participation-based programs and contingent wellness programs. And there was a lot of confusion on really what was a participation-based plan and what was a contingent health plan. These new regulations have done a good job of clarifying some of those issues. But a key point to these regulations is they've added a new category, and that's called an activity-only wellness-based program, and I'll get into those details. The definition of a participation-based program has been clarified, and a key provision of the final regulations was they've raised the incentive. If you have an outcome-based program, you can raise that to 50% based on a tobacco cessation policy. Let's get started with what is a participation-based wellness program. This is the most simple, straightforward type program. The general definition is the condition for obtaining the award is not contingent on a standard related to a health factor. What does that mean? You don't have to meet any goal at all to receive the reward. Examples out of the regs are if you get reimbursed for your fitness center membership, you don't have to go to the fitness center, you just have to have a membership.
I think that's that's kind of my category right there. I belong but not actually
That's right.
Okay?
That's right. Diagnostic testing, if you show up each year at open enrollment, you get a check for $250 for just going through the diagnostic testing. It doesn't matter what you do with those results, just as long as you go through the testing. You may have education seminars 3 or 4 times a year where there's a reward handed out for showing up. Again, that's participation-based. And in the final regs, they basically stated these are all passive activities. In the previous regs, they talked about walking programs and other types of programs were considered to be a participation-based program. No, you cannot have any activity associated with these new participation-based definitions. So, again, pretty straightforward. I have a lot of clients that are just doing a participation-based program. Here's the new category. They've added this activity-only category in order to simplify the regs. What we've had in the past is we've had this outcomes-based participation plans, and there's a lot of requirements that you have to go through, a lot of standards that you have to meet. So they added the activity program, and under an activity program, you don't have to meet a measurement, you don't have to pass a test on your BMI or your cholesterol. You just have to participate in the program.
And what's a BMI for our listeners?
Body mass index. Right. Examples of activity-only programs is a walking program, a diet program, exercise program. You just have to show up. You can go to the exercise program and you don't have to lose any weight. You just have to show up. But in order to be in compliance, the program must meet the 5 requirements. And these are the same 5 requirements that we've had with wellness outcomes-based programs. And again, I'm going to go through each of these and give some examples. But this also applies to an activity-based program. First, you have to be allowed to qualify for the award at least once a year. That's if you have a walking program and it's 6 weeks, you may have to offer that more than one time during the year. So it's reasonable for that person to at least be able to participate one time a year. The reward's going to be limited generally for an activity-based program that's not associated with tobacco. That's going to be limited to 30% of the cost of the health insurance premium. And that's not 30% of what the employee pays, it's 30% of the total cost of the premium. The program must be reasonably designed to promote health and prevent disease. It's just a reasonable program. When they talk about a reasonable program, in the examples in the regs, it states, okay, what's reasonable? Well, reasonable is 1 day a week, 2 days a week. You can't require that somebody meet every day after work, do the walking program. You can't, it can't be too difficult to show up. It's got to be a reasonable place and a reasonable time and a reasonable duration. Okay? The program has to have a reasonable alternative standards. That's pretty straightforward. What the regs say, let's say, for example, you have a walking program and you may be pregnant or you may have a hip problem. That employee can come to you and say, hey, the only type of activity-based program you have is this walking program at lunch 3 days a week. I can't walk because I have a problem with my foot. You have to come up with some other type of program to substitute as a reasonable alternative.
Bill, we mentioned earlier that tobacco cessation program is very popular with employers, and I noticed you have a 30% cap in terms of an incentive for non-tobacco use, but if you have a tobacco cessation program as part of your wellness, are you able to give more incentive than for other types of programs?
Right. You can go up to 50% if tobacco's involved.
Okay.
The regs say that tobacco could be part of an activity-based program, but I don't see that. I can only see tobacco truly being participation-based. That, look, we have smoking cessation. We don't care if you smoke. We're not going to do any testing. We're just going to say we're going to pay for the smoking cessation drug like a Xanax, or we're going to send you to the American Lung Association activity. We don't care if you quit. I consider that to be a participation-based program. And I'll get into smoking and talk about why I believe it's more like an outcomes-based program than an activity-based program. So the 5 requirements have to be met, and most people who've done a wellness program are familiar with these 5 requirements. Now, here's something new. Sample notice and disclosure. In order for your wellness program to be in compliance, your activity-based program has to have this type of notice language. And the notice language, the regs state, need to be included in all of the health plan materials. And I picked this up verbatim. If you do not have this disclosure talking about the reasonable alternative, you'll be out of compliance. Charlie?
And Bill, I want to draw everybody's attention, because this is going to come up at the second half of our presentation when we're talking about some of the ADA issues. That sample notice has some very specific language about alerting our employees to alternatives or accommodations, as it were, if this particular wellness program doesn't work. And that's going to come into play on the employment law side as well.
Okay. Thanks, Charlie. Again, the employers that I've worked with, they either want to do participation-based, activity-based, and I'm glad that they added this new category because it just makes it a lot easier to be in compliance. Now, let's go to the more difficult type of program, and I call this the outcomes-based program. And I've had a lot of problems with employers and a lot of confusion on what it takes to have an outcomes-based program. But basically the definition is the individual must meet a specific health outcome or attain a specific health metric in order to achieve this reward. Examples. If we have a smoking cessation program, the goal that you need to meet is actually stop smoking. That's the goal, and that's the ultimate goal that you'll have to achieve sometime during the program in order to get an ongoing reward. This also, again, very common with some companies. You got to have a body mass index of X, or your cholesterol has to be at a certain level, or your waist has to be at a certain size. Those are all outcome-based programs. Not as popular as the other type of programs that I've dealt with because of all the hoops you have to jump through. Let's go through the 5 requirements and talk about some of the requirements for an outcome-based program. Let's talk about the first one. You have to have the ability to qualify for the reward at least once a year. Again, with smoking cessation, if someone enters a smoking cessation program, you have to offer this program every year. If I don't stop smoking, I've got to come back and I've got to be able to qualify every year for that. Some of the programs, this is the minimum, is at least once a year. Some of our smoking cessation programs that I've worked on, they require you to go through the smoking cessation classes not once, but twice, maybe 3 times in a year. And that can happen. Let's talk about the reward. If we have an outcome-based program, the maximum reward or surcharge is generally 30% of the top cost of the premium. And if you have smoking involved in it, you can raise it all the way to 50%. And again, the program must be a reasonably designed program to promote health and prevent disease. Again, smoking cessation is a great example. In order to make it a reasonable program to promote health, it's got to be easily accessible. It has to be, it can't be undue burdensome on the amount of time that it takes to participate in the program. Also, too, well, mainly those 2 things. But I want to spend a lot of time on the reasonable alternative standard. And this is why a lot of employers do not do outcome-based programs. For example, if I have an outcomes-based program that says that in order to receive the reward, your BMI has to be, say, 25. Well, if my BMI is 35, it's not reasonable for my BMI to go to 35 to 25 in 1 year. So you have to custom these programs and tailor these for your employees. For example, it's impossible to go down 10 points in a year. So you have to work with each individual and offer them a reasonable alternative in order to meet the goals. And that may be first year, you have to bring your BMI down X%. You have to do certain things to participate in the program. But it's an ongoing program because if I bring my BMI down to a reasonable level, I'm going to get the reward. Even though I haven't reached the goal, I've met the reasonable alternative. Same thing with smoking. The ultimate goal is to quit smoking. Well, in order to quit smoking, what's a reasonable alternative? I have to offer a smoking cessation program. I have to actually say, listen, here's how it works. In the smoking cessation program, I'm going to offer it once a year, twice a year, and as long as you're going through the smoking cessation program, I am not going to charge you the surcharge. And you don't have to actually quit smoking, but you always have to be meeting the alternative standard, and that's the education and participating in the program. The cost of these exercise programs, diet programs, smoking cessation programs, in order to meet your ultimate goal, you cannot charge the participant for the cost of the program. However, one exception that the regs talks about is if you have a diet program like Weight Watchers, you have to pay for the Weight Watchers, but you don't have to pay for the food. And again, something that's new in these outcome-based programs is the same disclosure that we have in the activity-based program, you're going to have in the outcome-based program. Charlie, you have any questions on that?
No, I think you've laid it out very nicely.
Okay. Now, after I put the materials together, I left something out. So everybody's going to have to get their pen out because I want to go through a key point. And the key point that I want to talk about that I don't have a slide is the impact of the wellness incentives and the affordability tax under Internal Revenue Code 4980 HB. Under pay or play, we have what I call the A tax. That's if you don't offer a program, you get taxed $2,000 per participant. But if your plan is not affordable for a participant, I call that the B tax.
And Bill, when you're talking about the plan, you mean an entire health benefit plan, not just a wellness program.
Exactly, the whole health plan. Now, as most of you know, the pay or play tax has been postponed until 2015, but it's something to think about. Under the affordability tax, basically how it works is, okay, as long as I offer a plan, I now need to determine whether this plan is affordable. And under the code section, basically it says if my self-only coverage does not exceed 9.5% of the household income, my plan is affordable. Now, if my plan's not affordable and I'm charging more than 9.5% of the household income for the cost of premium, that employee can elect out of my health plan. They can enroll in the exchange, become qualified under the exchange, and then the employer is going to be billed $3,000 by the exchange for that employee. Now, something that most people don't realize is how do I calculate the affordability in conjunction with my wellness program. And I want to give an example. Everyone gets their pen out because I want them to take notes. My example is Mary makes $20,000 a year. She's single. And in order to determine what is the affordability for her premiums, I'm going to take $20,000 times 9.5%, and that's $1,900. So what I'm saying is I cannot charge her more than $1,900 for the cost of her single-only coverage. Now let's talk about my health plan. The total cost of coverage for my health plan for a year is $4,500. And under my plan, I make the employee pay 100% of that coverage. However, if you participate in my wellness program, I'm going to give you rewards to knock down the cost of the coverage. So I'm starting out with a total cost of $4,500. If you go through biometric screening, I'm going to give you a reward of $1,200. That's a participation-only program. If you are smoke-free, or if you enter my smoking cessation program, which is my outcomes-based program, I'm going to give you another credit for $1,500. Now, if I do an activities-based, if I either join the walking program or the exercise program or join up for Weight Watchers, any of those three, I'm going to give you an additional $450. So if you do the math, I take the $4,500 minus the $1,200 minus the $1,500 minus the $450, the total cost that I now have to pay for my coverage is $1,350. Now, you're on your face, you're thinking, well, my coverage is affordable because the standard is $1,900. Well, that's not how this works. When you're calculating the affordability tax, you start with the $4,500. The only piece of the wellness program that you can ignore is the smoking cessation piece of $1,500. So when I'm calculating how much my employees pay for coverage, I take the $4,500, I disregard the $1,500 for the smoking cessation. So in reality, when I'm calculating my standard, I'm taking the $4,500 minus the smoking for $3,000. I don't get any credit for my activities-based, I don't get any credit for my participation-based, and I don't get any credit for any other outcomes-based calculations besides smoking. So in this case, I'm treating my employee as having to pay $3,000 for their premiums, which is more than the $1,900. So this is not affordable. And so this employee can go to the exchange and elect coverage under the exchange and maybe qualify for the subsidy. A lot of employers have skipped over this, what I call affordability tax. Everyone follow through that calculation? I'm sorry I don't have the slide, but it's very, very important going into 2015 that you understand that. On my next slide, these are just some potential penalties under PPACA. Basically, you're going to be looking at the Tier A tax, and what that's stating is if I don't have the notices, or I don't give the reasonable alternatives, or if I don't offer the program once a year, or if I require employees to pay for their second smoking cessation program, I'm going to get penalized $100 for each person that participates in my plan. However, that penalty can't exceed $25,000 in any given year.
One other exposure, these penalties are apart from any hot water an employer could get in under the Americans with Disabilities Act or GINA. In other words, these penalties are strictly under our health care reform laws. They still, if they run afoul of ADA or GINA, may find themselves exposed to civil liability and under those laws.
That's correct, Charlie. I'm moving on to the next point. In Oklahoma, we have the Oklahoma Smokers Protection Law. And here we have this smoking cessation program, and they're in conflict. Well, under the Oklahoma law, it basically states that it's unlawful for an employer to discharge or otherwise disadvantage any individual for using tobacco. And there are some certain exceptions. And on the next slide, Brad, we talk about if there's a bona fide occupational requirement, you can restrict smoking. Charlie?
Well, we've been talking about how common it is for an employer in Oklahoma to have, as a part of its wellness program, a smoker cessation aspect, and you're telling us that Oklahoma's smokers protection law says we can't discriminate on the basis of compensation terms or benefits based on smoking. So how can an employer wellness plan that has a smoking cessation component, why would that not violate this state law?
Well, the way around the state law is you're going to have to preempt that state law, and the only way that we know how to do that is to draft a smoking cessation policy, make an addendum to your ERISA-based health plan, and the ERISA-based health plan will trump the Oklahoma state statutes, preempt the state statutes. So an informal policy that is not part of your health plan, we do not think that you're going to be able to preempt the Oklahoma state laws.
So if we have an employer that either has a smoking cessation program or is considering it, it's important they make sure it's part of their health plan and their health-bound document to get that ERISA preemption and not run afoul of our state law.
Absolutely, Charlie. I just want to make a couple other comments, some problems that we see with smoking cessation programs. First, in order to prove that you're a non-smoker to receive the reward, a lot of plans have what's known as an affidavit. And in that affidavit, you state and you swear to the fact that you're either a smoker or you're not a smoker. Well, we do have a few participants that may not be honest on that affidavit. And I've seen the affidavit state to say that if you're not truthful on the affidavit, we have the ability to terminate you from employment. Well, you really shouldn't be doing that because that's a violation of HIPAA. Termination of your employment based on a health factor, smoking as a health factor, you would violate HIPAA. The other point I want to make is I've also seen in a number of smoking cessation policies that if you lie about your smoking status, we're going to rescind your health coverage. You're not going to be eligible to participate in the future in the health plan. Well, the Department of Labor has come out, and there's also mention of it in the final regs. The Department of Labor's position is lying about your smoking status is not a material enough misstatement to allow rescission of your health benefits. So be careful if you've had that in your smoking cessation policy.
Thanks, Bill. Let's move to now the employment law piece of this, and we said at the outset there's going to be a little tension here between some of the things Bill has covered under our health care reform laws and what we find in the context of our employment laws. And it starts with basics involving the Americans with Disabilities Act, the ADA, and the basics, and these come into play in the context of wellness programs, include a limitation on employers on when and how they can require medical examinations after hiring, and that's when wellness programs kick in. An employer can't require me as an employee to submit to a medical examination. That includes medical questioning or inquiries unless it's job-related and consistent with business necessity. Now, our ADA regulations recognize an exception in the context of wellness programs. The ADA regulations say an employer may conduct a voluntary, and I want to stress voluntary, medical examination as part of a wellness program or an employee health program. The other ADA basic that we need to keep our eyes on when it comes to wellness programs is documentation. Bill mentioned exercise programs, educational programs, nutrition programs. Sometimes what we lose sight of is when these are part of a wellness program, they are treated as medical records. You may not think of an exercise program or nutrition classes or smoke cessation as medical records, but particularly when they are part and parcel of an employer's wellness program, treat them as medical records. That means they get the same confidential treatment as they do with any other medical records. So what we have in the context of ADA and wellness programs, two issues. ADA limits circumstances when an employer can make medical or health inquiries, just the sort of things Bill was talking about as options in wellness programs, and ADA requires wellness participants to be able to get the same equal benefits that non-disabled individuals would have when it comes to health benefits. And we're talking about wellness programs where some individuals potentially could reap better benefits or more rewards than others. Again, a danger. Now let's talk a little bit about GINA. That is the Genetic Information Non-Discrimination Act. Again, going to the basics, but we'll talk how this comes into play in the context of wellness programs. Under GINA, employers cannot discriminate against applicants or employees based on any sort of genetic information they receive. It's also unlawful to require or request any sort of genetic information about an employee or an employee's family members. Many of these wellness programs that employers are considering or have up and running are also designed to encourage family member participation. So that may include examinations, BMIs, blood screens, or educational processes or medical histories from spouses or family members. So again, in the context of GINA, we're not limiting ourselves when it comes to exposure to getting medical information just from our employees. We may be dealing with medical information from family members. And keep in mind, all this medical history, when we're asking an employee or an employee's family member to give us some history about past illnesses, past conditions, whether they have had or are continuing to take prescription medication, whether they've had earlier workers' compensation injuries or earlier hospitalizations, all those kind of inquiries and all that medical information and medical history we're receiving as an employer in the context of a wellness program is treated under GINA as genetic information. Now, GINA recognizes some exceptions for employee wellness programs. In other words, some wellness programs which by definition are going to solicit information from employees or their family members about past health issues or health issues of parents or that sort of thing. There are some exceptions under GINA. First of all, in order to comply with GINA, if you have a wellness program, in effect, it must be entirely voluntary, and the employee participants must sign a written authorization permitting the gathering of that information. Then the two other elements of the exception under GINA for wellness programs and gathering information really focus on what the employer has access to. To satisfy the exception under GINA, only the employee and the healthcare provider, whoever's gathering that information, can receive the employee's individually identified information. And put another way, any genetic information that is gathered as part of a wellness program regarding the employee or any of his family members, the only way the employer can see that is in the aggregate. It can't be ever disclosed or shown to the employer in an employee-specific environment. Now, I've got some language like Bill's. Make sure that if you have a wellness program, but really with any information, anytime you're seeking medical information, you'll see in this slide the GINA safe harbor language, and it certainly applies to wellness programs, but I think it's wise to have any time you are seeking medical information in an employment context, make sure your documentation includes this GINA safe harbor language. Now, I'd like to say that the EEOC has been helpful and a real guiding light on do's and don'ts about what to do when it comes to wellness programs and whether or not employers have violated GINA or the ADA, but it has been just a mystery. And I guess the best way to get a flavor for the twists and turns about the EEOC's position, to the extent they have one, on wellness programs, is to follow what they've done on the issue of wellness programs. And it starts with their 2000 enforcement guidelines. These are guidelines that were issued by the EEOC that were intended to help employers understand what they could do and what they couldn't do when it came to medical inquiries, questions about medical conditions or medical examinations. And as part of that 2000 enforcement guideline, the EEOC said, hey, you employers, you can conduct exams and you can ask questions about medical history so long as it's part of and the key word here, voluntary wellness program. And they said that means voluntary means participation is not mandatory, and employees that choose not to participate won't be penalized. And the examples of voluntary wellness programs in that 2000 enforcement guideline was blood pressure testing, cholesterol, glaucoma, and cancer detection, that sort of thing. Well, in March of 2009, the EEOC issued an informal opinion letter, really more of a non-opinion letter. The EEOC had previously said it was okay for employers to have wellness programs that had a reward of 20% or less of insurance costs as incentive, that would be lawful. Well, in March of 2009, 2 short months after that informal opinion letter, the EEOC withdrew the earlier 20% opinion letter and said, hey, you know what, we've decided we will not officially address whether any financial incentives are fair game and lawful under the ADA when it comes to wellness plans, or what level any sort of financial incentives would be appropriate, which to me is just a big question mark. About 5 months later, we did get an opinion letter that gave us a little bit of direction, and it's probably a function of how extreme this particular plan was. This particular employer, for the August 2009 EEOC opinion letter, required employees to answer a questionnaire about their health condition and health history, take blood pressure reading and blood panel screen, and if an employee refused to participate in that health risk assessment, they would not receive any health insurance coverage, employer-funded health reimbursement. So in that particular case, the EEOC said, look, if all your employees are required mandatorily to provide medical information as part of a wellness program and they're not going to get coverage otherwise, that's plainly not voluntary and that's plainly illegal. Again, a little extreme. 2011, again, really stepping up to the plate. The EEOC says in June of 2011, hey, just want to make sure everybody realizes we still haven't taken a position on whether an employer can offer any incentive or rewards or how much under ADA, and we just wanted to, if there was any confusion, we wanted everybody to know we're still not taking a position. But as to GINA, we do want to address GINA. We want everybody to understand that wellness programs, if you're going to offer them, they have to be open to all employees, including employees that are presently experiencing health conditions and including employees who, because of their condition or history, may have an increased risk of developing condition. Most recently, in January of this year, the EEOC addressed an employer that had a wellness program and waived the annual deduction if an employee enrolled and participated in that wellness program. And they made an important point here that is really consistent with what you heard from Bill in the context of health care reform and that sample notice he gave to you about your wellness program. And the EEOC in this 2013 opinion letter said, look, if you're going to offer a wellness program and it's going to have some incentive or some reward for participation, you're going to have some people who do not, can't do it or can't make that particular act of participation or can't hit a particular activity or are unable to reach certain goals. And if that's the case, as far as we're concerned, under the American Disabilities Act and under GINA, you have to come up, employer, with some sort of accommodation under your wellness program that would permit that employee to participate in some fashion and have a shot at earning the same rewards that are made available to everyone. So, unsurprisingly, when we look at the tack the EEOC has taken, it's really directionless. What's happening right now in Washington, around the country, employers are speaking out at public meetings, and they're asking the EEOC for updated and clearer guidance to take some positions on how wellness programs can be offered without violating the Americans with Disabilities Act, without violating GINA. And they're also asking the EEOC in new guidelines and guidances to explain how the EEOC piece, in the context of ADA and GINA, how does it interact with other laws, the HIPAA laws that Bill has talked about, ERISA issues, and otherwise. In other words, giving us a flavor for how we're supposed to deal with all these things. I think one thing, if there's any direction we can take at all from the EEOC to date, and it's consistent with what Bill has told us about the Health Care Reform Act, if you're going to have a wellness program, the outcome-based programs are going to be the riskiest. And if you're going to have a wellness program, I think we can say under our EEOC advice, again consistent with the health care reform suggestions Bill has given us, have alternatives for employees who say, I can't participate or I can't take part in that activity, have alternatives that will accommodate those employees and then give them an opportunity to qualify in another way for the same sort of incentives or rewards. You know, Bill, now might be a good time if you could tell our listeners or give some examples of what sort of things you're seeing out in the real world that employers are offering in terms of wellness programs.
Thanks, Charlie. Well, I work with a lot of employers, and I see a lot of different wellness programs, and they've changed, and they've come a long ways in the last 5 years. The most popular wellness program that I still see is a participation-based biometric screening. That's the easiest, it's the least expensive, and you get a lot of bang for your buck. However, something that has changed in the last 5 years. 5 years ago, I saw a biometric screening where you just went in and they did a blood draw, and they said, oh, yeah, you got high blood pressure, you have trouble with diabetes, you know, some early prevention, and they handed you a report. There wasn't a lot of follow-up. To be successful, you need to be with a company that does strong follow-up. Some of these are known as a concierge-type service. And with the follow-up, what's key is that employee calls back to the company and says, hey, where should I go to seek coverage? Now you as the employer, you have control of directing where that employee goes, and you can help manage the cost of your coverage. Because even if I go to a network provider for an MRI, I could go to facility A, and they may only charge me $500. Facility B is $1,000, or facility C is $1,700. When your doctor sends you to facility, they don't have a price list on the door. These guys know the most effective, the most cost-effective place to send you. It's key to have that direction.
And that even works in the context of a wellness program.
Right, and the biometric screening. And the most sophisticated type of wellness program we see today is the on-site doctor. The on-site doctor, larger employers, they've built out a clinic inside their facilities. We have doctors on staff. Some larger companies, they're on staff 5 days a week. Other groups, they're on staff 1 or 2 days a week. But again, they're doing the biometric screenings. They're holding that data, and they're there doing the follow-up. And they can also dispense a lot of the low-cost drugs on a low-cost basis because there's not any markup from the pharmacy. And again, with the on-site facility, they're helping with both your health costs and your workers' comp costs, because when you're hurt with workers' comp, that on-site doctor is the first person who sees that injured participants, and they're directing where they're going to seek medical care. And they're making sure that they're going to the low-cost provider in your network.
Well, and Bill, maybe, you know, we should use as an example, and this is pretty creative on the part of our firm's own wellness program. Bill has signed a pledge not to patronize Hideaway Pizza more than once a month. He signed a pledge, and he's wearing an ankle bracelet, which we track him, and we have on a map all the Hideaway Pizza, and we're in month 3, and he's been faithful to it. So, you know, don't hesitate to be creative in your wellness program. But, you know, we've thrown a lot of information out at you, some practical and some technical, but, you know, we really wrap it up with what do we do about a wellness program? And a few high points I think are important about focusing. First, make sure if you have a program up and running or you're considering to put one in place, make sure you're complying with those June 2013 final regulations Bill talked about. Another issue, remember, wellness information is medical information, even such things as exercise programs, diet programs. We may not think of those as medical information, but when we're offering them through a wellness program, they need to be treated as such. Make sure all your medical information requests have that GINA safe harbor language, and if you have a wellness program, make sure you have Bill's language for the sample notice and disclosure. And then ask yourself the question, hey, does our wellness program have any aspect that runs counter to the EEOC's opinion letters? And you know, I know those opinion letters are of limited value, but the one trend, and again, it's a trend Bill stressed in the context of our health reform law aspect of wellness programs. If you have a wellness program and people are getting incentives or rewards for participating in it, if you have individuals who, for some reason, cannot participate or can't take part in a particular activity, make them aware through that sample notice and disclosure language that Bill provided that other options are available where they can qualify for the same incentives and the same rewards. That way, I think you're going to be complying with the current state of our ADA and GINA laws and the health reform laws and that are in place. You know, this is a thorny area, but we shouldn't lose sight of the fact that wellness programs, they're a benefit for employees and employers. They reduce the employer's health care costs, and when they work, and they seem to be working, they improve the lives of our employees. And the trick we just want to help you satisfy is make sure that a program you have in place is consistent with the laws we've been discussing. Thanks again for participating in our wellness webinar, and hope it was valuable for you.
Before we close, just a few quick reminders. You'll be getting a follow-up survey about this webinar in the next day or so. Please take a few moments to complete that questionnaire. Your feedback helps us improve our events, as well as letting us know what topics and issues are important to you. And as I mentioned earlier, those who signed up for HRCI credit at the time of registration will be receiving that HRCI credit information in the next day or so. And later this afternoon, an archived version of this webinar broadcast will be uploaded to our webinar resource page, as well as, again, that downloadable version of the presentation materials. Both of those can be easily accessed, or that page can be accessed from the homepage of both employerlink.com and McAfeeTaft.com. And I want to again thank Bill Frudenrich and Charlie Plum for presenting today's webinar. And on behalf of the law firm of McAfee Taft, thank you for joining us for another Employer Link webinar. See you next time and have a great afternoon.